Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update, April 18th, 2021. It's been a bit since I've done one, and so a few things to go over. So first, COVID cases in Oklahoma are way down. We have the lowest number of hospitalized patients in the last almost year, 10 months, 208. The Integra system is way down. All the systems are way down. Makes sense because we're basically at herd immunity now. We're very, very close, and essentially we are, which is what I've been talking about for the last several months. Based on, we've had about a 1.5 million vaccines given, probably somewhere around 1 million people have gotten both doses or the one dose of the one they need. But as I've also explained, that one dose of any of the vaccines is going to be pretty darn effective anyway. So, it doesn't really, I think we have tons of people vaccinated. We've had almost 450,000 documented infections. Classically, it's 20% of your population minimally has been infected, or 5 times the number of true or of positive tests. So we're at herd immunity now. Essentially, there's going to be sporadic cases still because there's pockets of people who haven't gotten the infection, and we'll correlate that to the East Coast where there may have been a slower onset of some of the infection. So now that people can't do mitigation anymore, because you can't mitigate against an infectious disease forever. It's harmful, it's bad, it's terrible. I reviewed all the suicide rates, which I'll go over today, and I did that because I've been asked to give a presentation to one of the largest school boards in Oklahoma City, some of them, not a full school board meeting, about the benefits of opening schools and why we can get rid of masks. And so I want to be up to date on all the data. And the bottom line is this: if you're an adult and you have any high risk factors for infection from COVID that could get really sick, you get the vaccine. Okay? If you don't want to get the vaccine, I support your decision not to get the vaccine because it's an individual decision. We are not a dictatorial authoritarian regime. However, if you don't get the vaccine, think about getting caught up on your MMR, your measles, mumps, rubella, and DTaP, your diphtheria, tetanus, pertussis, because that's going to give you some collateral protection. Now, the vaccines themselves, let's talk about. The Pfizer and Moderna remain very stable. The update from the CDC this week, it's not a 95% reduction. It's essentially a 99.991% reduction in infection or documentable infection. So that's pretty darn impressive. I mean, they have 5,800 positive infected people out of almost 70 some million people who completed the cycle. Within that group, there's 7 deaths that are still being investigated. And were they COVID? Were they not COVID? We don't know. But again, that's the whole point of same themes. Your risk for a COVID death after you're vaccinated becomes essentially zero. I mean, because you don't know all the factors, and some people are going to die because they're just going to die, and they may or may not have had COVID at the same time. But the point is, the vaccines work. So there's no excuse at least in Oklahoma, and I understand some states are different because, again, I think if we've learned anything, it's that governmental systems currently everywhere are pretty fraught with dysfunction and disorganization. And so, but in Oklahoma, which is a very red state, we've run as high as the third highest state for adoption. We're currently, I think, in the top 7. And so we've had a great response here. And if you want to get a COVID vaccine, all you have to do in Oklahoma is go to a CVS or Walgreens, and you essentially can get one immediately. Now and then it may take a day or two, but it's pretty much there everywhere. And I'm sorry that it's not like that in every state. But again, look at your politicians and look how they failed you. And then number 2, if you're not in the United States, I'm sorry, because I know there's a problem with the vaccines being disseminated. Again, for a variety of reasons that I can't help you with, but I'm sorry. Because if you could get the vaccine, it would be wonderful. And so let's talk about the other vaccines. The Johnson & Johnson, what's come up with that is similar, perhaps a little different, similar to the concern that came up with the AstraZeneca. But the Johnson & Johnson vaccine seems to occasionally make or cause someone to make an antiplatelet antibody that is associated previously with heparin, which is a blood thinner, where you make an antiplatelet antibody that makes your platelets stick all together, and that can cause a blood clot in a venous sinus in your head. And it's 6 people out of about 7 million people who've gotten the dose, 6.5 million, all women 18 to 50. So what have we talked about a bunch of times already? We've talked about women have estrogen, and women who have estrogen have greater clotting proteins. And so they always have a slightly higher risk. You get the thrombosis from the platelets, and they may have more clotting, other clotting factors, voila, you can then have a big problem. And that's what it looks like. Now, at this point, the CDC and FDA aren't like, oh, we're not sure if it's causal or not. It's probably causal. but is there ways to manage it? Yes, like we always want everyone taking Advil and a Zyrtec or something the night before and the day of. I mean, if you're going to do the Johnson & Johnson now and you're a girl, I would probably have you do a baby aspirin for 3 days before and probably for 2 weeks after. Talk to your doctor. It's simple. If you've been on fish oil, which we have the vast majority of our patients on, and we've told them, essentially all of them to be on it if they're much over 30, or they have any risk factors. If you've been on fish oil continuously, your overall clotting dynamics with your platelets are low, but you would, again, I think doing baby aspirin for a few days before and a week after makes sense for anyone doing the Johnson & Johnson. But again, you have to talk to your own provider, nurse practitioner, PA, whoever, and see if you're a good candidate for that. I don't think it's a huge concern, but I do think, yes, we have to acknowledge it is a possibility for people. And since it's a possibility, and even if it's only 1 in a million, if you're the one, it's then a disaster. So why not take a few baby aspirin for a few days and help lower that risk? Baby aspirin for a few days generally is not 3 days on the front and for a few days after is really pretty harmless for most people. Again, who doesn't take baby aspirin? You don't take baby aspirin or any aspirin product if you're a kid, pediatric person, and you've had a viral infection because of Rye syndrome, which is where your brain swells and it can be lethal. So again, and that's why we got rid of Joseph's baby aspirin back after I'd gotten through my adolescence. So then let's talk about vaccines for children.
I have a question on what you were just saying. Haven't they paused the Johnson & Johnson?
They paused it. I believe they restarted it already. I thought they restarted it already. I thought I heard yesterday they'd restarted it. It was only a 2-day pause. But it is going to be available again because the FDA's made that very clear. But if you're worried about that, there's plenty of Pfizer and Moderna around and you can get those. But let's talk about kids. The kids' data is very straightforward. If you're under 14, the chances of you getting sick with COVID is so astronomically small, it's hard to understand numerically. If you're 14 to 18, it's essentially the same. You're not long-term damage. There's no documentation of long-term damage with mild infection. I just did a literature search on all of this. There were several papers that said that. There's just no evidence of it. COVID is just not that important in children. Of course, there's going to be people who get Kawasaki disease because people get Kawasaki disease with any viral infection where you get a systemic inflammation. What if my cousins' children did, but that wasn't from COVID years ago. It was just from a virus. It can happen. That isn't the reason to get a vaccine when it's an experimental vaccine. And I'm going to keep on saying that and saying it and saying it. And people who are promoting experimental vaccines in low-risk populations is nonsensical. It's nonsensical. The kids don't give it to the teachers. That is extremely well documented. They don't give it to each other. Kids get it from being at home with their families, and then they barely get sick, just like Hugo did. And so that is what's going to happen 99.99% of the time, essentially. So what's the effectiveness of a vaccine to make 99.99% of the people only get or stay only minimally ill? It can't get better than that. I mean, so there's no point in giving the vaccine. And then I've talked about the Marine study before, which showed about a 10% reinfection rate. Now they're a year later or whatever, or 8 months later, someone wrote an article saying this is why we need to get vaccinated. It's the complete opposite. The 10% of Marines who got reinfected didn't get sick. 90% of them were asymptomatic and 10% of them were minimally infected. That's not a reason. And there wasn't any documentation that they were spreading it amongst themselves that much. I mean, obviously they had some infections and it came from an outside source. But again, the basal rate of not having a complete immune response to a viral infection is 5 to 10%. Just so, again, we don't need to do that. And if you look at the other data from the National Institute of Allergy and Infectious Disease, which I put on, you get really good T-cell immunity over time from an infection or a vaccine that's going to be long-term. It covers the variant, so there's no reason in pushing vaccines on young, healthy people. That's just my personal opinion from reviewing the data, because you got to look at the risk, and there's risk to the vaccine. So you got to give it to people like me who have risk factors, being 56, guy, too many ACE2 receptors in my lungs. Even with everything I'm doing, I looked at it like, no, that's still, I don't want to be the guy who gets really bad COVID like some of the guys I know are 57 or 58 who died. And so if you're a high-risk person, get the vaccine. Once you get the vaccine, you're done. Follow your guidelines on masking. You're being courteous. Once wherever you are, the mandate goes away. Be done. You're not going to get infected. That's what the data shows, 99.9991% of the time or something like that. So you're fine. It can't be 100%. Bolts of lightning hit. So I think I've gone over that enough. Anyway, Kim, what questions are there?
Well, so what do you think about the WHO warning of the global surge? Because
the global surge is different. The global surge is because they haven't been vaccinated.
In Brazil and India.
They haven't been vaccinated. So that's the difference here. Our vaccination rate is at least, I think now 20 to 30% of the population. The infection rate is probably 30% of the population. 25 to 30, the cross immunity rate. So the only places where you're having lots of infections are places that haven't done well with their vaccines in a public health perspective has been the main thing. So when you go to all these European countries where they're at like a 5 to 10% vaccine rate versus 30% where we are, or 35%, because I can't keep track of it. It goes up so much every day. They're going to have infections. That's how it is. India isn't getting their whole population vaccinated. Brazil isn't getting their whole population vaccinated. But, that's the problem. We aren't in that boat, fortunately, but it's what's causing it.
Okay.
And I do want to say, if we hadn't had the great vaccine rollout, we'd be having another big surge. But the bottom line is, it's a cold and flu virus. And if you look at the data, too, from what we think is going on, it's going to slow down in the United States no matter what in the next 2 to 4 weeks at and then it would have come up a little bit again in the summer, but it won't, because we're going to have everyone vaccinated by then.
Okay. One person that tested positive is asking about antibody infusion treatment. Do you know anything about that?
Yeah, it's the BAM infusion.
Oh, it's the BAM.
So if you get COVID and you're positive and you're in Oklahoma City, there's somewhere on the south side, and I'm sorry I'm blanking on the name, but I'm a north side doctor, so we send everybody to Oklahoma Arthritis Center. Dr. Craig Carson's team has done awesome. They've infused a ton of our patients, and we still give ivermectin or doxycycline or Plaquenil with that. But the BAM infusions are the bomb, and there's no shortage of them in Oklahoma City. Oklahoma Arthritis Center, if you have a positive COVID test, call there right away, and they will get you in immediately. And again, I'm sorry that we have that here, and not everyone does.
If somebody doesn't have a primary care doctor, where could they go get an MMR?
Oh, you can get an MMR or a tetanus shot at Walgreens or CVS. Just walk in.
Okay. Do you think kids, you kind of address this, but with the variants, the British variant and everything, are kids getting COVID more easily?
I think we don't know the answer to that. We know the variant. When you're looking at the infections now, they're more the variant. But there's no increase in kid infection rates, and there's no increase in kid illness rates. So I, again, don't think the variants matter that much. I mean, in the United States, as the CD or the NIH paper I put out from the 31st of March showed, the T cell immunity, which you get both from the infection and from the vaccine, and I'll put that back out online again, clearly showed cross protection, and that was the author's conclusion against all the variants. He basically said we don't need to worry about it once you get the vaccine or you have the infection. And remember, I've talked about, for those of you who've been bored and watched enough of these, one of the interesting things on the South African variant was that the non-neutralizing antibodies from the original infection were neutralizing against the South African variant. So it's not as big of a deal. If you've been infected, you're fine. If you've been vaccinated, you're fine.
Okay, so you've talked about if you've been on zinc for X amount of time that you could cut down.
Yes.
Do you suggest that even if you haven't had the vaccine and
If you haven't had the vaccine, you probably want to take your zinc 3 times a week. If you've been taking it regularly, if you have had the vaccine, take it twice a week. That's fine. There's other cold viruses and stomach viruses, and you know, it raises your alpha interferon, which fights cancer. So it's great for your hair. So yeah, a little bit of zinc is good for you, but you don't have to do it as much if you've been on it. I mean, we always wanted people to do it daily for the first few months and then cut back to 3 to 4 or 5 times a week. And now with the way everything's going, I think we can do it twice a week for maintenance if you've been vaccinated or infected, and 3 times a week if you haven't.
So one person got the vaccine and had side effects like numbness, half of the face drooped. It didn't sound like they got full on Bell's palsy, but half the face drooping. But their question was, should they get the second vaccine?
So the question is, if you've had a more significant neurologic side effect with the first vaccine, would you get the second vaccine? I'm a common sense person. No, I wouldn't. I mean, you don't want to have a neurologic problem like that. And especially since the one vaccine is going to be essentially protective 95% of the time. And again, get the SARS-2 COVID quantitative test from LabCorp. There's been some confusion about this from doctors who don't understand it, and so I want to make it really clear to everyone. This is a specific antibody test to the S1 regional binding domain of the spike protein. It is the exact test that they used in the Pfizer trial, the Moderna trial, the AstraZeneca trial, and the Johnson & Johnson trial. So if a doctor tells you, oh, that doesn't tell you anything, tell them they're an idiot and they don't know what they're talking about, okay? Because if they will actually get off their butts and call the lab and get the report, and then if you're me, when it was first came out, I called and contacted the national lab director and went over it with them to make sure it was the exact test I needed it to be to prove if people were responding to their vaccine or had gotten antibody levels from the infection that were specific to inactivating COVID. And so it is the exact right test to get. And as so many doctors don't read anything, it gets me annoyed that then they say, oh no, that's not the right test. Yes, it is. Read something. That was for my friend Carl Ruskowski. because he always enjoys when I get all mad at the other doctors. He's very funny. Carl's like the best doctor in town, him and Alita Thomas. So, hey, what can I say?
Okay, so more questions.
And, I don't want to leave out, Norman Imes, who's also the one who taught me or sends me journal articles 24/7.
So MMR.
Yes.
If you had that in the past, I'm assuming as a child, then are you saying no vaccine? Are you saying not to get the vaccine if you've had MMR?
No. The whole thing is I want everyone to get the vaccine. Get the vaccine if you're over 25 to 30, or if you're under that and you have a lot of risk factors. Okay? And then everybody over 25 to 30 should get the vaccine. That's my personal opinion. I'm totally good with the Johnson & Johnson. I did the Pfizer. What did you do, Kim? The Moderna. I mean, I think they're all fine. Once you get the vaccine, you're out of jail, and you provide out of jail for the country. You stop variant transmission that can mutate into eventually a different variant. I want everyone to get the vaccine. But I have enough people I've talked to in my practice that it's like beating my head against the wall that are not going to get the vaccine. I don't want them to get COVID and get ill and die. And so an alternative strategy would be to make sure your MMR and DTaP are caught up. You'll get some cross protection. It is not as good as getting the Moderna or the Pfizer or the Johnson & Johnson, but it at least can offer some cross protection that's significant. It is, again, and that's just good policy for everyone, because you never know when you're going to get a rusty nail. And I laugh about that because I stepped on a rusty nail a few years ago and I was like, oh crap, I haven't had a tetanus in like 10 years or 12 years, so I went and got one. And then since I was an OBGYN, I kept up on my MMR. So that probably helped me not get infected. But even with being caught up on all those, I still immediately got my COVID vaccine when I could, because that's the right thing, I think, to do. Very strongly. And the other part about that is, if you're someone who doesn't get the COVID vaccine, don't expect someone like me to wear a mask for you, okay? You need to wear a mask to protect yourself, or don't wear a mask. At this point, I don't care. The bottom line is this: we need to return to freedoms. We need to be able to be normal. And so I made the decision to get the vaccine so I don't have to wear a mask. And I can be normal, and I can look at people and they can see my face when I'm talking to them. But if you don't feel comfortable getting the vaccine, you probably should still wear a mask. But if you don't want to, I'm not going to care. But just remember, you could infect someone else, which would be harmful. So I think you should probably wear a mask.
So with what you just said, I know there's going to be comments about CDC and everybody saying even if you get the vaccine, you still need to wear a mask.
It's baloney. It's idiocy. It's complete lack of any intellectual or scientific integrity. I mean, the people at the CDC, I mean, their own data shows you shouldn't. I mean, it's like there's a scientist here and there who are like, oh my God, I got to get this data out. Just like the guy at the NIAID, Fauci's division, that showed there's long-term immunity. How he snuck that out of that division, I don't know. That repudiated everything that Fauci said, but they do. And so scientists are getting the data out that there are things we don't have to do anymore. And the number one thing you don't have to do anymore once you're vaccinated is wear a mask. You don't have to, but you follow your state guidelines or your local guidelines, because why be a jerk? Just follow the guidelines. Don't argue with people. Don't cause more stress. Everybody's stressed out.
Okay. The only other thing you had some people comment on your comment of being on double secret probation, and they were. Do you even know what that's from?
Why I said that?
Yeah. Do you know that's from a movie?
Yeah, Animal House.
Okay, yeah.
Yeah. I'm old. Yeah, we're on double secret probation. I mean, they monitor anything we put out. It's great. It's like having well, I made a reference to the Nazi Party before, so I'll refrain. But it is kind of like having the Gestapo now, where you can't be truthful, and if you are, they take your post down. But that's life. It's corporate America. All right, be safe. Good night.